Cloud. Okay. All right, and thereby we can officially start. So it's a great pleasure for me to introduce today's speaker of this dggö talk, who is Maksym Obrizan. Maksym got his PhD from the University of Iowa in the United States, and he's currently a professor of the Kyiv School of Economics. In his research, he covers an interesting mix of topics, including transition economics, health economics, and macroeconomics. He is one of Ukraine's most well-published and cited economists. Further affiliations of Maksym Obrizan include the World Health Organization and the University of Duisburg-Essen. At the University of Duisburg-Essen, he's a frequent guest and speaker at activities organized by SINCH, our research center for health economics, and on our course programs. But most importantly, Maksym is a distinguished expert on the Ukrainian healthcare system, which is the topic of today's lecture. A final remark before I hand over to Maksym. During the talk, you are all muted, and you can, if you like, write questions, clarification questions into the chat, and I might pick up some questions and ask them to Maksym as we go along. But you will also be able to ask questions after the talk. So that's all I have to say. So Maksym, the floor is yours.
Thank you very much, Martin, for presentation, for introducing me. Thank you all for joining this talk. Let me start right away because I have too many slides, I think, so I'll have to maybe rush through some of them. Because obviously it's like topic very interesting for me because, you know, I have been working on it all my life. And so let me just real quick launch the presentation. And I think I'll share the presentation afterwards, right? So if you need some links from it, it may be helpful. The topic is very broad, obviously, right? It's health system at the limit. I didn't want to focus only on this most recent tragic developments, right? Because you see it in the news. I wanted to give a little bit of history of what's been going on, a little bit of updates on the reforms which have been done in Ukraine, and then in the end, of course, it's unavoidable that we talk about this brutal aggression. So we have briefly 4 parts in the presentation. So first I will start with the Semashko healthcare system, which was the initial state of healthcare in Ukraine when it gained independence in 1991. Unfortunately, for many years, it hasn't been reformed like healthcare systems in other European countries, like which joined the EU. That's why it's so critical for Ukraine to become part of the European family, right? It regains its membership sort of in Europe. Only in 2017 that some reforms started, and I'll touch on these reforms as well. And actually, quite a lot have been achieved, right? I was surprised that a lot of things have been done, right? When you live in the country, maybe you don't feel they happen immediately, but I think over this 4 peaceful years from 2017 to 2021, a lot of things have been achieved. Of course, you probably heard about ProZorro as an example of these reforms, but many other things happened. So I'll talk about reforms. I'll talk about whether these reforms have been timely. Some of them have not. I'll talk about some statistics, obviously, and then I'll talk about in the last part, you know, what's going on now and sort of what to expect. So again, Martin mentioned a lot of things. Here's like a short list of my publications. I think my major achievement in the last years, they became a researcher at the WHO Council for the Economics of Health for All. It's a revolutionary council. We have very strong, it's only women on board, like who are council members. I guess you heard about Mariana Mazzucato. My sort of the person I help most, it's Marilyn Warren, right? She's been a New Zealand politician, and she first started, since she's a founder essentially of feminist economics before it was picked up by Nobel Prize winners. So again, it's a great opportunity for me to contribute to this like very high level policy agenda. And I'm teaching in Iowa, I'm teaching at KSC, I'm teaching in, obviously in University of Duisburg-Essen and other places. As Martin mentioned, I have some research on the topic, right? So there are like papers which are more like academic, which are about self-rated health in Ukraine and changes in those. and also some paper, like a paper on changes in healthcare use using this life in transition data, which is like fantastic data source to study transition countries. So again, by transition countries, we mean former members of the Eastern Bloc, including Ukraine, including like Poland and, you know, Czech Republic and others. And also, I have been quite for a while a consultant. So we've done an interesting study for the World Bank. It was about financing of healthcare in Ukraine, and we discovered like some very interesting things that, in addition to official channel of financing, there could be completely a shadow way of financing where the head physician of this hospital will be accepting some additional donations, right, to his kind of own account and pay out of there. So that's kind of the tricks of you know, the healthcare system, which is sort of not in ideal shape, which wasn't in the ideal shape before the war, but now of course it's been much worse. So hopefully, again, my expertise will be useful, and I'll be happy to share any insights I have and the data which I collected, the data I worked with. So let me briefly, and now I'm, as it was mentioned in this announcement, I'm like now displaced person. I've been studying displaced people myself right now. I'm one of them, and I'm currently in Chernivtsi. I was like just walking around the street, and I saw this Joseph Schumpeter teaching and doing research here in Chernivtsi, which was like a part of Austro-Hungarian Empire. You know, obviously it was more than 100 years ago, but again, it was like very interesting to observe this. So again, if you come to Chernivtsi, you can find this memorial plaque just to, you know. So again, I'm proud to be the same place as Schumpeter. So again, I'll try to, you know, infuse some humor, right? Because the topic is quite tragic, but you know, otherwise it's too sad. And so let me briefly talk about the Semashko system, right? That's sort of Eastern Bloc after the Second World War, up until things started to improve, right? So Ukraine gained independence in 1991, right? So Ukraine will be somewhere here in this part. But of course, many countries have been oppressed, right, by Kremlin troops, right? And of course, we all know what's liberation mean in Russian, right? It's a very specific term, essentially oppression. A lot of things have been done in these countries, which have been occupied essentially, including the imposition of this Soviet style of healthcare system, right? So I don't know if you heard about Semashko. He was like the first minister of health in Soviet Union. And a lot of countries in the Eastern Bloc have adopted some form of the Semashko system. So it's highly centralized system. Some people call it a healthcare system of the military state, essentially, right? Because it provides this equal geographic access to services. But again, it's highly centralized. It's fully funded by the state. It's fully controlled by the state. Of course, again, we have to be kind of objective. So it had some good features, I would say, right? At least on paper, it guarantees some free access to healthcare. And given that in some of these countries, like in Ukraine, for example, the roads may be not in ideal state, obviously, this was ensured through equal geographic access, right? So in every village, you'll have some kind of, you know, practice, and then at this rayon level, county level, you have like this rayon level facilities, and then again, you go up to the sort of the level of oblast, which is kind of regional level, and then you go up to the Republican state, and then you go up to the Moscow sort of level. Of course, we understand that maybe it's not the most efficient way, because given that the system has been hit badly by opening to the world markets, in particular with respect to the cost of medicines, right? And in particular with respect to the cost of utilities, right? Like energy. So obviously, a lot of these facilities have been a burden, right, after the 1991. And in our study, for some hospitals, you know, utilities would be like 30% of their cost. And of course, it's not very efficient, right? Sometimes even more. So again, it has like, when you have cheap energy, cheap medication, it's fine. But when energy is very expensive, you know, the system starts to collapse. So as everything in Soviet Union, it was all owned by the state. So it's managed by local authorities, but still there'll be very tight supervision and control by the government. Salaries have been paid also by the state for medical personnel. So it started from this polyclinics, which is kind of a place of practice, joint practice for all physicians at one place for outpatient care. And again, for those who think it was a very equal country like Soviet Union, they shouldn't forget that large factories would have their own facilities, right? So if you're lucky to work at some large factory or large plant, then you will also be getting access to this sort of only for these workers of this plant, right? So again, you couldn't say that it was very fair, right? So if you are just like a regular I don't know, physician, or if you're a regular teacher or a regular engineer, you can only use like this sort of state, but not this sort of medical facility of this particular factory. Again, in principle, I'm trying to be here objective, right? So we can say that it was relatively efficient, right? Given that leftover principle of healthcare financing. So some people estimate that 60 to 70% of the budget was spent on military, right? And again, I now going to believe in that more, right? After February 24th, and maybe a couple of percent only was spent on healthcare. But of course, there was like this propaganda that we have the best healthcare system in the world. You know, we are super cool. Again, I remember it from my childhood, right? Because I was 7 or 8 years when it was still in progress. But again, objectively speaking, you know, in principle, healthcare was available to most people. Infectious diseases have been kept under control. Mortality was reduced substantially, and including infant mortality. And also these factories and plants where most people would be working, they would require annual checkup, right? Like X-rays and checkup for all physicians. And if you don't get this checkup, you will not be able to work. So again, at least there was some progress with early detection. But of course, there was an issue with new technologies, right? People couldn't get access to it because again, it's severely underfinanced, and of course, this have not been, not of these technologies have been available. And again, given that proletarians, right, were the elite, right, of the state, they could also get better healthcare through their sort of own occupational medical facility. Like they would have their own hospital, and if you work at this place, you could get access. So in terms of the motivation for physicians, I think there was not enough, obviously, motivation for physicians. Like to give you one example, a young doctor just after the medical school would probably make like 120 rubles, but unqualified worker could make 300 rubles, right? So there was basically no point in going to the medical school, study there for 6 years, then go for internship for another 2 or 3 years. And after all this effort, you know, you will just become sort of underpaid. And of course, with this level of pay, there was this even joke that good physicians don't need salary, right? They don't need salary because patients will thank them, right? It's like it, and it was kind of morally acceptable, right? Because everybody knew that physicians are not paid well, so and they would just take bribes, right? And it can be like a cash or just a gift, you know, champagne or chocolates or something like this. Of course, jobs were guaranteed by the state, right? There is no unemployment, and salaries were extremely low. And I think almost every region would have a medical school because it was kind of a prestigious job. And people, I think, like the number of physicians, I'll show you some evidence. I think there was kind of too many physicians per capita. And of course, we cannot say that the quality of all of these physicians was perfect, right? But at the same time, we had that medical facilities did not have sometimes, you know, basic equipment. So like my conclusion here is that it was overstuffed, but kind of under-equipped. Let's now move on to the question of what happened in this part of the world after 1989 or 1990, when this country started to gain independence from Moscow. So we had 10 lucky countries which became part of EU, right? New European Union members. We had countries with some marginal reforms like Moldova and Russia. And we have countries with very little reforms like Ukraine and Belarus. Again, things changed after 2017, but between 1991 and 2017, I think there was no big change. So if you look at these groups of countries, like EU members, I think they moved back to their European origin, right? They moved back to this social health insurance systems. Of course, I want to show you some evidence that obviously the Semashko system, it was focusing on hospital care. And in addition, I think there was oversupply, right? So there was no control of quality, but there was oversupply of physicians and there was oversupply of hospital beds. So this picture, it's for 1991. It's hospital beds in per 1,000 people, again, from World Development Indicators. And you see here that Ukraine is among leaders, right? So they have like something like 12 beds per 1,000. So surprisingly, Germany and Czech Republic are also here, right? But you see that other countries actually have much smaller numbers of these hospital beds. For all my graphs, I picked 3 countries, right? I picked, so here you see that Poland and Ukraine, they are kind of neighbors. Poland is our very close friend because it accepted majority of our refugees, right? So like friends forever. It's actually have been one country back in the day, right? And so I bring here like Germany because, you know, I'm speaking obviously at German university. Poland and Ukraine, just for comparison, like 3 countries. And you see here that, for example, for Ukraine, there have been a decrease in the number of beds, right? So data starts from 1980. So the sort of independence was 1991, somewhere here. But you see there was like in excess of like 13 beds, which is probably too much, right, per 1,000 people. And gradually there was some improvement, right? The success capacity was reduced. I think similar trends actually observed for Germany, right? And for other countries, like for Poland here, it's actually less, right? It's always been less, and it remains less than this amount. So the second number about this excess provision of physicians here, once again, it's 1991. It's the number of physicians per 1,000 people. Here again, Ukraine is among leaders, right? I think at some point it had the highest number of physicians in the world. There were some statistics like that. Again, obviously, I don't think I'll show you later one slide where you will see that the success capacity leads to excess utilization, right? You have sort of too many physicians, right? Too many hospitals. We have to provide sort of them. It's like supply and induced demand, vice versa, sort of, right? Where sort of and like there's this paradox of ghost patients, right? So in Ukrainian system, some hospitals produced fake patients because they have been paid per treatment, right? So like these patients don't exist, but they have been on paper. Again, from 1991, from the day of independence, there have been some improvement. So once again, I compare Germany, Ukraine, and Poland here. And you see here that Ukraine in 1991 had, among the 3 groups, the highest number, and then gradually it decreased, right? Like this number of physicians per 1,000 people. So again, that's probably like a very slow reform which was going on, right? Because of underpayment, some people migrated to other countries. Some physicians left the job. My brother, he was anesthesiologist back in the day, but now he's head of a large pharmaceutical company. Because he had to pay for his family, he didn't want to take bribes, and that's why he kind of moved 20 years back. I mean, of course, it would sound like a joke because in Germany, anesthesiologists would probably make, I don't know, a few €100,000 per year, but in Ukraine it was like ridiculously low salary, right? So he was forced to quit this job, and so like that's probably the only reform which was going on, that people have been choosing different occupations. So like if you want to look at Ukrainian healthcare between 1991 and 2017, I suspect that there was not much change, right? So The constitution guarantees that universal unlimited access to free healthcare. There have not been any insurance mechanisms. And unfortunately, I think Ukraine is quite poor, realistically speaking, right, compared to Poland, compared to Germany, even in purchasing power terms. And again, up until recently, up until maybe the last 4 or 5 years, there was not sufficient funding, right, for the healthcare systems. And what we have low wages, we have sort of a lot of incompetent physicians, we have informal payments, and we have drop in the quality, right, unfortunately. Again, before 2017. I'll talk more about reforms which have been done. Of course, you can have, I don't know, whole course, right, not just like a short presentation on what's been done. I have participated in evaluation of some of these reforms. And I can list a few of them. So there have been improvement in the payment because of the capitation. There have been shutting down a lot of hospitals and hospital wards. There was, before 2017, there was extreme level of corruption in terms of government tenders. So like, I don't know, like it sounds like old mafia movies, but essentially, like there was a government tender and it was kind of closed, and only if you have connections, you can win it. And sometimes it was ridiculous, right? Sometimes they would specify in the tender requirements that you have to supply the specific device, and only one company would be sort of supplying this device. So it was so obvious, it was rigged, right? At the moment of tender announcement, it was clear who will win it, right? Because they would require like specific requirements which are just one company is provided. Again, somewhat improved after introduction of ProZorro, which is a sort of award-winning procurement system. I think many countries follow this interesting development. And another point is, of course, this paternalistic society, right? So many people in Ukraine believe that the government must take care. I think it's improving. I think it's not as, especially like for younger people. But again, back in 1991, it was like everybody believed that government must provide this healthcare, and it's not our responsibility, right, to take care. I had one study in which communists, members of the Communist Party, they would sort of have lower life, they would have lower self-rated health, right? Because they don't care about themselves, but they care about some mythical community, right, or something. I would not be sort of supportive for all the initiatives, for all the reforms which have been done. For example, one of the reforms for which international financial institutions would push is to shut down a lot of these countryside hospitals. And again, unfortunately, I think it didn't went very smooth. I understand that we need to save money, but often, essentially, let's say, you may shut down a hospital in sort of like a village or like a small city, and then people have to travel, right, to another city to get care. And of course, sometimes it's problematic, especially for older people, given that roads are not perfect, bus schedules are irregular. I'm not saying that all reforms have been beneficial, right, in terms of access, for example, to care. So let me spend a few slides on the reforms since 2017. So there have been a lot of attempts. There have been 25 years of unsuccessful changes. And finally, Dr. Uliana Suprun, she was American-Ukrainian. So again, many people made fun of her, like made jokes about her, as about any politician. But I think she was probably the most successful in terms of launching these reforms, essentially, right? So in 2017, these laws have been passed, and she had a couple of mantras. She's been speaking all the time over TV that money should follow the patient, right? So we don't sponsor hospitals or physicians, but we want to allocate money after the patient, right? So patient chooses where he wants to get treated or she wants to get treated, and then in this way, money will follow him, right? Not like that. You have this hospital. Maybe half of the city has left the city, but we still have this old, there was like, I think it was called Order 333, which would specify the number of physicians per 1,000 inhabitants, right? And of course, a lot of things happened. Like we have urbanization, we have movement of people out of cities. So again, these orders did not work. So we really had to change this way of financing. The other important concept was introduction of family doctors. They would make agreements with patients. Patients can choose with whom they want to make this agreement. And the salary of the physician depends on the number of signed contracts, which is, again, I think, fair. And again, as usual, there, like sometimes, so we had this national system of healthcare, which published, which develops these dashboards. And you can actually, now they're disabled because of the war, but before the war, you could check for every city, for each physician, right? You can find physician by name or by specialty, and you can see how many contracts they have made, like how many agreements. And it was like sometimes funny because in some cities they have like, 3 times the population of the city made up contracts with local physicians, which is of course ridiculous, right? So it's either that the statistics about population is incorrect, or again there is some fake, fake patients existent here. Again, hopefully this capitation reform kind of forces physicians to be nice to their patients, right? Because it directly affects their salary and keeps them satisfied. So supposedly it should increase satisfaction, patient satisfaction. But at the very least, I know that the salary of physicians sometimes quadrupled, right? So it increased by a factor of 4. And for the first time, unless you're talking about, chic private clinic, if you're talking about like a government sort of public physician, for the first time, this salary was comparable to what industry would pay, right, for the similar level of, expertise, which is good, right? Because before that, again, physicians have been underpaid very much. Yeah, right. Okay. Yeah, there was like this even jokes that our guard, there's some movie, and like the actor says our guard is working as physicians there, because sometimes they have to do like double duty at some other jobs. In terms of financing, likewise, there was a lot of corruption, right? Because sometimes government was underfinanced, and sometimes it was just like stolen at the hospital. But the reform actually made clear, so they made public which medications are available at hospitals, and patients can check. And also of course, in Ukraine, there was this problem of avoiding primary care. So people would go directly to specialists, right? So they would go directly to cardiologists. And of course, specialists are very expensive, right? So part of the reform was to force everybody to go to primary care physician. They call them family doctor, who is supposedly can treat 95% of cases, and only through sort of if this primary care physician cannot help, then you can move to the specialist. So in addition to so basically the state wanted to sort of reallocate patients from going directly to the secondary care to the primary care. In addition, there was this program which is called Dostupni Liki, which is accessible medications, which would cover, which would reimburse for the first time in history the cost of medicines for a number of life-threatening conditions. And even at the side of training, of physician training. So first of all, there's a movement toward international protocols in treatment. And second, they have tightened the requirements, right? They have tightened the examination requirements. And unless you, and some medical schools, lost a lot of students because their graduates could not pass this medical test. Yeah, so there was like, and of course, again, medical education was also very corrupt, right? It was very difficult to get into medical school without a bribe, unfortunately, right? That's sort of, yeah, and so there have been some improvements here as well. And I think probably the most well-known reform, it's ProZorro, right? It's an award-winning government electronic procurement system. So it's translated as transparent from Ukrainian. Obviously, there is some connection to Zorro. It's been very publicized. It has been studied a lot. There are a lot of sort of USAID grants to study it. The focus here was what, again, according to optimistic scenario, 2 billion from public procurement of 11 billion was kind of stolen every year. I think it's actually underestimated. I think it's much more. But the idea was to improve the situation, and this Prozor actually requires all public tenders, even if it's like a small local community, to go through open access online platform. Given that the legal system doesn't work well, this transparency is a key to success, right? Because the principle of Prozor, everyone can see everything. Which means that you can, for each specific tender, government tender, you can check the participants, you can check their documentation, you can check their bids. So basically it was very, and of course people studied, and like you could see if like a similar medication, right, or similar medical device would cost much more at some particular tender, it will create a question, of course, and people would ask questions. And in addition, they had developed this very nice business intelligence module where you can also look at savings, right, sort of the amount which was initial of this tender, and then there was this auction to reduce it down. And again, there are of course anecdotal evidence that people still managed to overcome it, but at least at least it's not at the scale of enormous stealing, right, which was before, because it's public, because it's transparent, and people can check it. And here's like one example. It's how Prozor was used for purchases of artificial lung ventilators during COVID. So it's a map of Ukraine. So here you have the number of devices purchased and total cost. So basically you can look up in this BI module, you can look up, for example, for ventilators, and it will get you all the information, sort of who supplied it, what was the price, how many bidders have been there, and so on and so forth. So a lot of information here, like to study corruption, for example. And of course, Transparency International and journalists and everybody's watching it now, right? And there have been some scandals. So at least it's not like completely fighting corruption, but at least you kind of limit corruption a bit. And also a parallel reform, which also started around 2017, was decentralization, which is given more money and more power to local authorities. And even before Zelensky was elected, people started noticing that in some remote areas, there was a lot of reconstruction, a lot of building, a lot of like even hospitals. I was surprised because my father got to a hospital in my city of Kremenchuk, which you probably learned all a couple of days ago. And I came to this hospital and it was renovated. It was a big surprise. Like they had a new, everything renovated, new equipment. And it was like, it's like not like a Kyiv, right? Not like center. So to give you one example, here in 2021, a lot of hospitals have been reconstructed or built. Emergency departments have been reconstructed. Rural outpatient clinics have been reconstructed and built. So there was a lot of these sort of nice trends, right, when the money was used to help people. Right. So in terms of whether reforms have been successful, of course, it's a little bit early to say, maybe it's actually too late to say if reforms after 2017 have been successful. It's very little time has passed. So it will be more like over the whole 30 years, right? There's like very slow movement initially and then very fast movement, maybe last 4 years. So we want to look at three things: health status, public satisfaction, and sort of financial risk protection, right? Again, this like Harvard flagship approach to health reform. So these are the three key objectives of any healthcare reform. If you look at the some basic statistics like life expectancy, not ideal, but like sort of number one statistic you look at. All countries in the Eastern Bloc experience substantial decrease in life expectancy because of many reasons, right? There was suicide rate increase, alcohol consumption increase, alcohol poisoning increase, also traffic accidents, right? Because it's like collapse, right? The systems that worked before 90s stopped working in the beginning of the 90s. And of course, violent crime also was very sort of widespread. So like just to give you one example, so here again we have life expectancy, that's 1991, beginning of sort of the Ukrainian independence. You see a sharp decline in life expectancy, and gradually it started to improve. Poland, also transition country, a little bit less, but still you can see here somewhat, decline in life expectancy. And of course Germany like constantly have been improving over time, right? So again we have upward trend after, I guess, I think 1995 was probably the worst year in terms of economy, in terms of everything, right? Because it was like a really sharp decline. Okay, so that's about healthcare. So this is like some statistics, again, a little bit dated. Here is Ukraine, so I'll have to move quickly here. So we have inpatient admissions, we have hospital stay lengths, right, in days, and you have outpatient clinics, right? And if you look at Ukraine, in many cases, it actually has much higher utilization, right, compared to, so here I provide for comparison, I think that's interesting group, this new European Union states like Poland, Bulgaria, Romania, and so on, right? And across many characteristics, right? So for example, I think the most astonishing here, it's average length of stays almost 2 weeks, right? Which is, so it's not clear what the patient would do 2 weeks in the hospital, right? Compared to only, 1 week like in this new European Union states, right? So you have the success network of physicians, hospital beds. Obviously, somebody has to use it. And we have this also overutilization, right, of healthcare. So we do have some reduction in this overutilization, but I think it's still higher along many dimensions. So one of the reasons will be ghost patients, right, when it's actually should be, sorry, typo, where sort of hospital makes fake patients, right, because they're compensated on the number of cases. So some people said that hospitals would even accept homeless people in winter, right, to keep their beds occupied and sort of to keep these people in warmth. Again, it's like, sounds like an anecdote, but I think in some cases it's actually have been true. Right. And in terms of changes in healthcare use, again, this is like from one of my papers. I think it's very interesting because it compares 2010 with 2016, and it compares sort of increase in private healthcare use. So, and here I include also purchases of medications, right? So because we have data on health expenditures, right? And from that data, I have constructed this sort of indicator, private healthcare use, because in Ukraine, I think there was some kind of separating equilibria, right? So people who are older and poorer, they would still go to the public healthcare facility. People who are younger, maybe better educated, they will either go to a private healthcare facility, or they'll just go to a pharmacy and tell them, okay, just give me something for my head, and that's it, right? They won't even see a doctor because of the lines, because of corruption, because of the bribes, right? They don't want to interact, right? So personally, I don't remember the last time I've been to the public hospital, right? Because it's kind of very sad, right? It's corrupt and dirty and line, and so it's kind of so here I have again public healthcare use and private healthcare use. Ukraine here, it's in this part. So basically what we have that between the 6 years, between 2010 and 2016, before the reform started, right? I think this is probably one of the reasons why reform started, right? Because it could not continue in this way. People more actively use sort of either pharmacy or private healthcare, and they are less likely to use public healthcare facilities, right? So it's based on something like 1,500 observations. It's a reasonably good representation, and again, it's based on the survey data, right? So people less likely to report using this public but they use a private healthcare or just a pharmacy. And in terms of patient satisfaction, that's the data for 2017. You see that in a big city of Kyiv, I think that level of satisfaction along these 5 different dimensions is kind of comparable to sort of European countries, right? So again, fair guess here stands for Germany, right? Maybe slightly less, but in rural areas, you see there is substantially lower level of satisfaction with the care. And again, it's not just like medical care, like this red line, but it's also like, for example, accessibility, right? Something I mentioned already, right? So you may need to take, I don't know, you may need to travel by bus 20 kilometers just to get some basic, checkup or something. Right. So again, there is like obviously some heterogeneity here, right? Like urban areas, richer areas are fine, right? But maybe these rural areas are not so good. So the second question is about financial protection, right? So how much people have to pay out of pocket. We had a very nice discussion today at, actually I'm out of time. So Martin, should I speed up a bit or?
Yeah, if we could wrap it up in a couple of minutes so that we have time for questions, that would be good.
Okay, right. Yeah, that's because, yeah, sorry. Yeah. Okay, so again, obviously corruption here, it's important, right? So here I have a simple graph showing that Ukraine has quite low per capita health expenditures and quite high level of corruption, right? So here it's like 35% of visits in 2016 to a public healthcare facility would end up in a bribe, right? So every third, which is tremendous. And so let me briefly just go over maybe the last developments, right? So I'll obviously, that's our country after February 24th, very tragic, very crazy. And like these achievements, right? We mentioned this renovated hospitals, these new facilities. That's how they look now, right? That's a city of Trostianets, right? So the left picture, it's they have just rebuilt it completely. They brought new equipment. It's very nice. Like hospitals in Ukraine did not look that nice before 2020, and that's how it looks now, right? So it's just crazy. Yeah, and like there is some statistics about casualties. So I think currently, I think it's kind of overestimate. I think currently 2 million people are abroad because many people came back. 7 million people, which is like Ukraine is under 40 million, maybe 38 million. So it's a huge number of people who relocated, right? So we relocated to Chernivtsi. We have spent here 3 months already. And of course, it's tragic. 323 healthcare facilities have been attacked, right? Which is just crazy. And of course, I think these numbers are too optimistic. They look scary, but they are too optimistic, right? Only for the city of Mariupol, they after Kremlin occupied it, they don't even, they don't even recover corpses. They just, wipe it out and just throw it away. And I think it was like something like 400,000 people. 100 only left, stayed, right? 100,000, and the most optimistic is like 20,000 people have been killed. That's again my hometown, Kremenchuk. I think this is probably the most brutal attack. So it's how it looked just maybe a year ago, right? This store, and that's how it looks now. Okay, so it's just like a rocket, almost a ton of explosives. Obviously, everybody who was inside was killed, and it's just So my city was on the news, which is of course I would prefer not to have it on the news all over the world, right? So and it's a small city. It's a 270,000 people, something like this. Yeah, so this of course very, very tragic. So to wrap it up, again, I hope that we had 25 years of sort of no change. Then we had like very rapid reforms from 2017, like decentralization, capitation, public procurement. reconstruction, right? And it's hadn't been all crossed out by this crazy Kremlin troops with all this infrastructure destruction and casualties. However, you know, Ukraine may be corrupt. That's true, but Ukraine is democratic, right? And Ukraine is actually has its future, right? And just to end on an optimistic note, that's a lady. So she's from a city of Gorenka, like some small village. So her house was destroyed, but she's still making this, baking this traditional, you know, Easter sweet bread, right? So I think this country cannot be defeated, right? So I want to, you know, I want to stay optimistic, right? Because that's why I'm still here, right? That's why I didn't. Martin invited me to Essen. My other friend invited me to Geneva, but I'm staying here. We will win, that's for sure. So thank you. And if there are questions, please go ahead.
Thank you, Maksym.